To True Health Live, your favorite public health podcast. We are live on YouTube, Facebook, and audio on your favorite podcast platforms. If you're interested in public health, then this is the space for you. Greetings, everyone. Welcome to another episode. I think it's episode 53 of True Health Live. So today we're actually diving into a crucial yet overlooked topic. I wouldn't say overlooked, but it can be very nuanced, and I think like some parts get popularized or really popular in the media while other parts kind of get overlooked. So I'll say it like that. The nuances aren't always equally have equal attention. So, and that is today we're diving into menstrual health. Earlier in the season, before the season started, my co-host and I, we talked about, some of the things that we wanted to cover, and menstrual health was it. Um, last strong, May 28th, Tuesday, May 28th, was actually menstrual health hygiene day. And that's a day that was created and kind of organized by Menstrual Hygiene Day organization. They're an international organization. And normally I'll do something where some of you who know me personally, you know that I'm part of Anu Life Global Ministries, and one of the ministries is Red Wrap. And usually Red Wrap will put out something for menstrual health and hygiene day, but this year we did not. But I figured it would be cool to kind of combine, some of those efforts and talk about it here on the podcast, which we've kind of done in the past. We've had conversations in season 1 about a doula. So for those of you who are just now joining, are not necessarily familiar with True Health Live, definitely check out season 1, and we have conversations about reproductive health and doulas and midwives and whatnot. But we never really had the conversation about periods. So we're going to talk about periods today. And so, and I know sometimes people come in a little bit late. So as people come in, I'll definitely reset the room for those of you who are listening and don't necessarily see the video or the live. And feel free to ask your questions, whether you ask them live or you ask them in the chat. So, what are we talking about? We're talking about periods. So we're going to explore basics of menstrual health cycle, why it's important, especially this part, why it's important to talk openly about periods and how these conversations can actually improve your menstrual health for those of you who have periods, for you women who have periods. And we'll discuss some common menstrual disorders, like things to look out for, lifestyle changes that can positively impact your cycle, and what most women know versus what they don't. Plus, I'll talk a little bit about some of what Red Wrap, I know Global Ministries Red Wrap is doing, because it's awesome. And so we'll have some events this summer. So we would definitely love for people to volunteer or send in donations. And I'll also talk about another kind of project Red Wrap has as well. So, what are some basics of the menstrual cycle? So let's start with that. So, I would ask a question, but I'll say, I want you ladies to think about, how many cycles are in your menstrual cycle. Do you even know? Is it something that you actually sit down and think about? And that may be different depending on what kind of journey you're on. For women who may be trying to conceive, they're probably very in tune with their cycle and really thinking about what's supposed to happen in what phase and what looks like, what things look like, how they're feeling. But for many of us who move around just okay, well, it's the next month. Is it that time? We kind of look out for the PMS signals and things like that. But how often are we really, diving into and paying attention to the cycles? So the cycle, our menstrual cycle, actually consists of 4 main phases. So that's menstruation, the follicular phase, ovulation, and the luteal phase. Menstruation is when our uterine lining sheds. And that usually lasts about 3 to 7 days, according to the criteria that some uh, uh, health systems like go by. Most go by is the FIGO, but it's the acronym is a little weird. It's the International Federation of Gynecology and Obstetrics. It's like eight or less days, but the average is like 3 to 7, and really drilling down to like 5. Speaking of which is why Menstrual Hygiene Day is usually May 28th, because it's supposed to it's a nod to the average day that women bleed 5 days, and the average amount of days in the cycle, which is 28 days. So that average amount of days like means like from day one of your cycle to day one of the next cycle. So however many days that is between the 2 day ones, that is the number that they're counting to figure out like how many days are in your cycle. And that average is usually 28. Peace, beloved. I knew Peace House of you. Y'all, I wasn't looking. Sorry. Welcome, welcome, welcome. So we're talking about menstrual hygiene periods. So we just went over the phases. I'm not sure how much you caught, but like if you can, so as people are coming in the chat for you women, like how many cycles, don't Google it. How many cycles are in your menstrual cycle? And if you can, try to name them all. So we'll I'll look for those answers in the chat, or feel free to come on live. I will share the link in the chat for those of you who are interested. If you hear something, or if you have a question, always feel free to ask. Then we have the next phase. I won't say them, so I'll wait for some of those answers in the chat. Then we have the next phase, which overlaps, and all of them pretty much kind of overlap with one another. And that, it starts on day one, and it ends with the next phase, which is around day 14. And then that next phase, that third phase, is when we release an egg from the ovary. And that's triggered by a surge in a particular hormone. And again, I'll go. I heard you say 5. I did not say 5. When I said 5, I was talking about the average amount of days that a woman usually bleeds when she's in that particular cycle phase of her cycle. So the question is, how many phases are in a menstrual cycle? So there's usually average 28 days in a cycle, but that's average. It's not necessarily, doesn't necessarily mean it's true for all women. And usually, and on average, women will bleed. That bleeding phase is 5 days. So that's when I said 5. So, but there are a specific amount of phases that the menstrual cycle is divided into. So we're seeing like what folks know, because a good part of the conversation is also about like what most women know versus what we don't, right? So that final phase of the period, I'll go back and I'll name them as I see. No worries, no worries, beloved. And I'll name them as I see things in the chat. We'll come back to it. But that final phase is when progesterone is introduced to prepare the lining for a potential pregnancy. And then we know after that final phase, we start all over again if there is no pregnancy. And so again, that cycle length, it can actually vary. The average is 28, but I do want to, share that it can vary from 28 to about 35 days. And again, according to the International Federation for Gynecology and Obstetrics, anything less than 21 days is seen as abnormal or irregular, and anything greater than 35 days is also, abnormal or irregular. At the same time, you do want to pay attention to if you are kind of skipping around. That is like the normal cycle days, like 21 to 35. But if you are, someone who's usually like, on the clock, like maybe 23 days, 24 days, and then you find yourself like looking at 35, that can also be irregular as well, because that's not necessarily normal for you. So those are some things you do want to pay attention to. So, some stats. There are approximately like 14 to 25% of women actually do have irregular cycles. And that is something that can indicate an underlying health issue. So we always want to look at that. So let me see some of the comments. I'm thinking the phases are in reference to your ovulation cycle, when you begin your cycle and when you end your cycle. Yeah. Yes, but that's not all. House of US is menstrual, ovulation, low progesterone, high progesterone. You got two right. The other parts with the hormones, that might be an occurrence within one of the cycles, but they're one of the phases, but they're not phases on their own. Um, so I'll also put, so I don't necessarily see anything else. I'm not sure if there's anything on LinkedIn, but I'll share. It's a good answer. So I'll share them. So the 4 phases of our menstrual cycle are menstruation. That's phase 1. So day 1 is the first day you bleed. So menstruation is the first phase. The follicular phase is the next phase, and that kind of overlaps with menstruation and the next phase, which is the ovulation phase. So what happens in the menstrual phase? We're bleeding. There was no pregnancy, so the lining of the uterus is shedding, and there's, so you'll see, like, and it comes out like different pieces, like there shouldn't be too much clotting, but you're gonna see some clots because it's not flesh, but it's can be like chunky pieces of lining that'll come out, and it's all bloody. There's the follicular phase, which, as I said, it overlaps with menstruation, which starts on day 1 and it ends um with ovulation around day 14. So that follicular phase is kind of happening simultaneously. And that's what's happening when the follicle is preparing the egg for release. And then ovulation is the actual release of the egg from the ovary, which is triggered by a surge in your LH, or luteinizing hormone. And then that puts you in the luteal phase. And so which is phase number 4. So phase number 4, the luteal phase, it follows with our corpus luteum producing progesterone hormone, which prepares the uterine lining for a potential pregnancy. So it's important to note, kind of what's happening in each phase, so you kind of take stock, or take note of how you actually feel and what's going on. So those are your 4 phases: menstruation, and maybe we'll do a quiz at the end. Menstruation, follicular, ovulation, and luteal phase. Um, there are some things that I did want to kind of go over, like, which is like what most of us know versus what most of us don't know. And this is really, really fun for me sometimes, because when I do this with our Red Wrap program in Anu Life Global Ministries, I find out something new every time. I find out what, some women, because again, we don't talk about this enough. This is what I said in the beginning, what some women know versus what some don't. And also sometimes I speak to younger and younger audiences, and there's a lot that is not explained, and some of these things I had to even learn, and only learned when I started to do more of this public health education work around menstrual health and hygiene. But there are a lot of common myths and misconceptions about menstruation. So for sometimes people believe that the cycle is exactly 28 days. And as I said, that's an average. That's average, but it's not. That's not the case. It is not exactly 28 days. And your cycle can vary. It can widely vary. And I said between that 21 and 35-day range. But if you find yourself kind of skipping around, then you want to kind of look into that, because that's not something that you want to do. And it doesn't mean that you won't have, some cycles like within, a year's period where you might kind of shift. Sometimes seasonal shifts, sometimes what we eat, that will have an effect on, the length of our cycle. Speaking of which, even vaccinations. So there was a study that showed that the COVID-19 vaccination did have an effect. At least what they saw was at least 50% of the women surveyed and studied did see, after getting vaccinated, a increase in cycle length, like so delayed cycle. So it took their period longer to come between periods, bleeding time between the next bleeding time was longer, and also heavier bleeding. There was a a there was one part of that study, though, they did not necessarily have a measurement of what the women's cycles length were before. So they were really heavily relying on, and this was done like via mobile survey. So they were really relying on, what the women knew of their own periods. So, and most of those things, you don't necessarily need a doctor to tell you like your cycle was late. People know when they're late versus when they're not. So what they did see, and this was over several countries, what they did see was delayed cycles as well as heavier bleeding. So that's just an example of how, things that we do, whether it's medications, whether it's a vaccine, things that we do externally can affect what's happening internally. And we'll get into more of that because there's a whole lot. This may even have to be this may even have to be two shows. So what are some stats and facts? So, obviously, we know that the 28-day thing is not a static thing. It's not set in stone. And the cycles can vary. And additionally, we all don't experience the same symptoms. I think that one is pretty, well known. We don't, it's not uniform across all women. But one thing that is interesting is that a lot of women are not necessarily aware that severe menstrual pain could be a sign of conditions like endometriosis or fibroids, or something else more severe. So if you are, pretty young, it doesn't even have to be pretty young, but if you are like in that earlier phase of starting your periods and they're very, very painful, that's not normal. And we'll get into that. That's actually a disorder which is called dysmenorrhea. And so we'll get into that where it's really talking about like the painful periods, but something that you're experiencing like that should not necessarily be happening. There's a good number of women that believe that irregular periods are normal because we kind of we I think we get lost in everybody's different, and this is true. And so that means like, sometimes like you might have something irregular happening, but you've normalized it, right? So like if, oh, well, I just have painful periods, kind of like that. Or, oh, well, I just bleed heavy. These are things that are not necessarily things that should be happening. And so you want to definitely talk to your medical provider, whether it's someone you deal with that's a naturopath, because naturopaths are licensed physicians, many of them, and you can find one, or someone who is more conventional or into allopathic medicine. So like, just like, oh, well, I just have really bad cramps, or they're really bad. You shouldn't be out of commission. And I can say from experience, I used to be that person, just like, well, I have bad cramps. And this is when I was much younger. I used to have really, really bad cramps, and it used to be like, okay, well, this is just something that I go through on my period. Those are irregular things that should never be normalized, because they can be underlying symptoms for something else. And a lot of times like we're having these irregular periods and we're having these symptoms, but we don't necessarily seek medical advice. So definitely make sure that you're seeking out medical advice. And if there are any questions, please feel free to, ask them in the chat, on whichever platform you're on, because I'm sure I should be able to see everything. Um, so, so one thing I did want to share, like, so in alignment with, kind of normalizing what's irregular, but like really, but focusing on like things that should not be happening. Um, and also things that have started to happen over time, like collectively to women. So a new study released by it's actually a longitudinal study, the Apple Women's Health Study. So as I was reading it, it was very similar, and you can catch this episode, I think, in season 3, when we talked about reproductive health issues and like cervical cancer, and the sister study. So the sister study is a longitudinal study that We talked about this in the first episode of season 3 when we talked about hair care. And so this one, it really talks about the correlation between perms and ovarian cancer and cervical cancer, and that surge of women, especially women of color, that we saw reporting and presenting with um, reproductive health cancers, and citing that it was from years of use of perms, basically, and different hair care products. And so, in alignment with that, there's the Apple Women's Health Study, which is done in partnership with Harvard University, their School of Public Health. They found that actually age of menarche is actually when women or girls start their period. It is the age where menstruation starts. So they go, and this is like around puberty. So they go from not having a period to the period starting. So that is called menarche. And these are some things that I go over in our talks with Red Wrap. And speaking of which, if you are a high school junior or senior or first year college student, and you're interested in like summer enrichment and scientific enrichment, Columbia University has a wonderful program, and I'm promoting it because I'll also be teaching there. And if you want to learn more and dive deeper into menstrual health, like, you can enroll in that program and sign up for my workshop. We do have a question in the chat. What does it say? Can you share? So, Beloved Anu says, can you share on how the idea of pain when it comes to our menstrual cycle is normalized based on race? I know we touched on it on the House of Yuya channel with Deanna. So, there's the idea that pain, and I don't want to go too far off of what we were talking about, but um, I'll mention it really quickly because we'll come back around to it when I start talking about some of the disorders. But there's the idea that women of color specifically, and I did watch it, so I think this is what you're referring to, and you can put in the chat if this is not what you were referring to. The idea that women of color can withstand certain levels of pain more than other women of other races, and so. And I think we did talk on some of this even in one of the episodes on mental health, on how also even still within melanin dominant communities, we ourselves kind of like push away, like, oh, it's okay, I'll be okay, when we don't necessarily tend to seek. Yes, I can share the link to the workshop in the chat, and I can uh I'll share the link to Columbia's information so you can sign up, because it'll be next month in July. But there's this idea that we can withstand. I say we, women of color, specifically Black women, can withstand a certain levels of pain, or tolerate higher levels of pain. And so when it comes to things like that, a lot of issues and a lot of situations in reproductive health, whether it's menstrual health or other areas, we're not necessarily listened to as much, right? I'm not sure about what the actual pain level is. And I'm not talking about, when you're in the doctor's office and you have that chart of smiley faces and it says rate your pain from 1 to 10. Everybody has to do that. But there's another level that, physicians use, and or the way that they're taught in medical schools, where they don't necessarily, where they are, in some situations still taught that people of color can tolerate higher levels of pain. And we've seen that in many, this is why we have things like informed consent, and we've seen that in many historical examples of studies where where experiments were run on people of color without anesthesia, or things were done without their knowledge, just to see how we would do. So that's kind of part of, if I think, and I don't know that y'all went as deep as that, but that's part of like that idea of pain in the menstrual cycle and it being normalized. So it's normalized in two different ways. Like, it's normalized in the healthcare system, where it is erroneously believed that we can tolerate higher amounts of pain, or when we say something's wrong, we're not believed all the time. But then there's other, and we can even share anecdotally within the community, and whether it comes from just all kind of being like, well, I'm not hurt anyway, so I'll just deal with it. Some of it comes from that, or like, well, some people we love to struggle. There's a love of struggle. And so when there's like pain, there's not necessarily a seeking of help all the time, right? And then, but I do want to be, I do want to, make sure that it's a full picture. Sometimes it is also that lack of trust that still exists when it comes to people of color and the healthcare system. So there's a lot of things happening in that. So hopefully that answered your question, but we'll get more into like some of the pain when we talk about some of the disorders. Um, so yeah, the new study, the new study released by it's the Apple Women's Health Study with Harvard University. And so what they found was that menarche is starting earlier. So so this is again a longitudinal study, which means it's been done over years. So it actually started in 2019, and they're still going. And I think you can still sign up, but and it's Apple. So I had to look. I'm like, why are they calling it Apple? Because it's Apple. Like it's um, the I operating system. It's Apple. So they actually enrolled people via mobile. So if you had an iPhone or some sort of Apple mobile device, you probably saw the you know you know advertisement or whatever to enroll in this study. And I think you can still sign up. So they've had, it's been going on for a couple of years now. So they've released, several different studies of information that they've been able to gather so far. And so this is, it's actually looking at women right now who were born in the years from 1950 all the way to 2005. And of course, like the years that have the most enrollment are the 90s, 80s, and the 70s in that order. So those people who were born during those decade areas. And what they noticed was, and this is a cohort of over 70,000 women, it's like 71,340 something. And what they noticed was that the average age of menarche has actually it's actually gone lower. So let me give you a little bit of context. So what they've decided is early menstruation is 11 years and under. Very early menstruation is 9 years and under. And late menstruation, which they are recording, is anything greater than or equal to 16 years of age. So what they wanted to look at for this particular part of the study was to evaluate like the timing trends and the disparities in the the onset of menstruation, and the time it takes to regulate. Because most women know that when we start our period, it's not just like, okay, we have a period, it comes every month. It takes a minute to like kind of regulate and normalize. And they wanted to look and see that. And I think usually it's about a year or two before your period, after the onset, it normalizes. So what they were looking at is like, the different trends and disparities in your women's menarche or onset of their period and the time to regularity. And they also explored the BMI. So like women who were able to report like height and weight, like retrospectively, that means they were able to calculate BMI and looking at so meaning at the time of, because you're pretty young. So at the time of your onset of your menses, your BMI also as a mediating factor. So across the entire cohort, what they found was the median age was 12, right? Those born from 1950 to 1969, so they took a 19-year span, they found that the median age was about 12 and a half. But then they kind of skipped those 1970s, 80s, and 90s, and then they looked at the 2000s to 2005. So those who were born in 2000, 2005, those folks would be between like 19 and 24 right now. They actually saw that the age decreased to 11 years old, right? And so we know that what the parameters, 11 years old is considered early. The other thing that they noticed was that amongst women of color, and especially Black women, that those ages were that the gap was actually much more much more early, if that makes sense. So like the age is still also decreased to like 11, but they saw it amongst more of the women. um, and also what they did find that much of what they found in that study, it also supported that early menarche, which we have known for a while. So studies done since 1983, all up to even more recently in 2021, early menarche is associated with increased risk of adverse health outcomes, heart disease, breast cancer, spontaneous abortion, and even like premature death. Whereas late menarche has also been associated with increase of other health risks. So delayed periods, which would be late menarche, have shown risk for also various cancers and heart disease, etc. Then, as far as the BMI part is concerned, the BMI at menarche could be a potential mediator of the different trends in the age at menarche or onset of the period, and how that might have affected the time and how you kind of normalize. And after I read this, I was like, yeah, I was chunky when I was younger, and started my period at that time, and it was like, and I remember like those were like the worst times, like the most painful times. And I was, one of those, and along with my mother, like thinking like, okay, well, you just have, painful periods. One thing that we did realize, like, okay, if the volume is heavy, that's something that you need to. So at least, when that started to happen, it's like, all right, let's go. Let's go figure out what's happening, what's going on. But I know one thing that we did not want to do, because a lot of the times, at least back then, doctors would immediately, okay, we'll just put you on birth control to regulate it. And that's not something that isn't necessarily like the best answer all the time, because even, because birth control it affects your hormones, and it is a personal decision. If that's something you want to do, just make sure you have all of the information and that your decision is informed, and it's just not something you're doing because that's what's done. Okay. The other thing that is interesting to know is like, it's kind of like the everyday thing. So like what we know, what we don't know. Like, do we know like about like what a regular versus irregular is? Do we know like what the average age of menarche or the onset of the period should be for those of you who have daughters or nieces, or young girls that you're taking care of? And the other thing is like, do we know how the products that we use may affect our menstrual health, right? And how we bleed, the volume of the blood. And I'll particularly say about, like, for example, beauty products, right? So part of this is some of what we went over in my workshop last year, and the kids did amazing with this. And it's talking about beauty products, and some of them containing what we call endocrine disrupting chemicals, right? And so anything that an endocrine disrupting chemicals are things that affect your hormones. Your endocrine system is what regulates your hormones. And those can, or they're called EDCs. And those can adversely impact our menstrual health, right? Anything that disrupts the hormone, because our cycle runs on hormones. It is, the luteinizing hormones that signals, it's a complex network of systems of hormones that trigger each stage of our menstrual cycle. And our menstrual cycle is like the foundation of our reproductive health, right? So if we're using things that have endocrine disrupting chemicals, and so an example are like parabens or phthalates. And I'm not going to go too deep because I want people to enroll in the workshop so we can learn more about it. But those are things that disrupt our hormones, and can, cause hitches. I'll say hitches in the process of how our body works. We talked about that a little bit, not necessarily endocrine disrupting hormones, but, using products and using things or eating foods that, disrupt the process of what the body is supposed to do naturally. And we talked about that in our last episode on bumps. So, if you have any questions or, you thoughts about, any kind of skin imperfection, especially like what's going on under the skin and bumps on your skin and what kind of bumps there are to look out for, take a look at episode 52, because we talk a lot about bumps, and some of that is how that happens. We're using things, eating things, whether it's topical or internal, that disrupt the hormone process, and disrupts the process that your body's natural process of how things are supposed to develop or how things are supposed to move. So now we'll get to like recognizing the different menstrual disorders. So it is crucial for maintaining your overall reproductive health. Some common disorders are dysmenorrhea, which is painful periods; menorrhagia, which is heavy bleeding, it's hemorrhaging, really, or amenorrhea, which is the absence of menstruation. And then there's also like PMS, premenstrual syndrome, right? And that can include a variety of physical and emotional symptoms. But it's important to pay attention to all those symptoms, and they're going to vary in severity, but you definitely want to seek advice from, whoever your medical caregiver is. And so we know like a good majority, around 80% of women experience some form of PMS. 20 to 30% suffer from severe menstrual pain, which could indicate, as I said before, conditions like endometriosis. Sometimes, again, doctors will put you on hormonal birth control to help manage disorders. But again, these things are also kind of interfering with your hormonal process. So a lot of times, like, something that, I'm going to put you on birth control because we're going to treat the symptom. We want to find out what the cause is, not just treat the symptom, find out the cause. And so sometimes the cause will be, and we say this almost every show, is a lifestyle change, which we will get into. Is look at, what are you eating? What products are you using? What is it that you could be allergic to? What is it that you could be having an adverse reaction to that is causing, you to experience certain symptoms? So it's not just like, oh, I'm going to treat the symptom so it goes away. It's what is the basis, the bottom line? What's the genesis of that symptom? Where is it coming from? And that's what you want to do with anything, any kind of health issue that you are experiencing. The other thing is, and this is related to everything that I said before, is like, benefits of conversation. So one thing I've learned, like when we're doing Red Wrap or when I'm having like the workshops, it is talking openly. I have learned over the years that, women, we don't talk openly enough about our menstrual health. And I want you to think about, like, even when we go to the doctor, like how that conversation goes. Some women are more comfortable, but for the most part, like, and I know it took me, and I'm speaking from experience, it took me like a minute to like get to that point where I could actually speak to a clinician very kind of frankly and openly about what's happening with my menstrual health, because again, it can be an uncomfortable experience, like in the gynecologist's office. Like, you kind of like, especially if it's pap smear time, it can get really uncomfortable and awkward and weird. And some people just don't like it. And with that, I would say, like, some things where you can start to make yourself feel more comfortable. Like, what does your physician look like you? Because a lot of the times that shared experience, or shared experience that you have with a um, clinician or caregiver, can be the thing that kind of helps break the ice, right? And when I say shared experience, it doesn't necessarily mean you've gone through the same exact thing, but you have knowledge of what you can be experiencing. Because if I go to somebody and I explain something, this is kind of like the basis of where we're getting, like, there's this misconception or this erroneous idea that people of color, specifically Black people, can tolerate higher levels of pain, but going to someone who looks like you'll know that, they'll understand that, well, they should, that's not the case, right? And you won't have to explain. There's some things you won't have to explain because there's a shared knowledge of your experiences, right? Then the other thing is the open conversations. Studies show that women who discuss their menstrual health, they are more likely to seek medical advice and support. Um, I remember during a preparation for a workshop with Red Wrap, and I'll also put links to Red Wrap, the Red Wrap ministry and initiative. So for people, I'll just go back a little bit for people who want to donate or volunteer or find out more information. I'll put it in the chat and in the description box. But in prepping for a Red Rep event a few years back, a young girl, because I've been trying to do things with groups that are younger and younger, and a young woman, she was a teenager, but a like young teenager, approached, and she kind of pulled me to the side and whispered. And this is where I'm talking about, like, that part about getting comfortable, like talking about our periods, even if it's amongst one another. Like, and I'll say one of the great things about Red Wrap when we do these events and our primary audience where we provide menstrual products and workshops is with women who are experiencing, women and girls who are experiencing housing insecurity or unsheltered or some sort of hardship with housing. And so she pulled me aside and she says, one time, I don't know why I'm whispering, but she says one time, and she's whispering, and she says one time I experienced, I bled for like 2 months, and I literally like stepped back and looked at her. I'm like, in no way, shape, or form is that normal. And she was kind of like nervously laughing because I think she knew ultimately like something's wrong. And in the moment I thought she was talking about it had happened recently, and then as she kept going she was like, no, this happened like maybe like a year ago. But they didn't, her guardians did not call, like they did not go to see any sort of physician until like after 2 months had already passed. And it took me back to a moment where I had experienced something similar in my 20s, and I bled for 2 weeks straight. And so to give context, it was after like a very prolonged cycle. The cycle had been really, really, peace on the radio had been really, really delayed. And so immediately it was like, well, it wasn't immediately because it was 2 weeks, but I called the gynecologist and she was like, okay, this is probably what's going on. There was a delay because, I had to explain to her, like, this is what's happening. Like, I didn't know, but I was like, I'm going to give you all the information, word vomit, or, story vomit. Like, this is what's happening. And so she's like, all right, this, it's not necessarily too much to get, you're cleaning out. You probably have a buildup because you haven't bled. But the point is, like, these are things like even that bleeding for 2 weeks, bleeding for 2 months, like anything over that 7 to 8 day period, it should not be happening. So if those things are happening, we do have to kind of take a step back and think about what are the things that we're doing every day that we may think is normal. Or it is normal for us to, like, I'm using certain products to clean my house. I'm using certain makeup products, or I'm using certain hair products that we have normalized that we do all the time and are not realizing how it's adversely affecting our menstrual health and hygiene. So those are definitely some things to think about because they're real. When we're talking about the different products that are in beauty products, the different ingredients, the different ingredients that are in beauty products, where the beauty products are manufactured, depending on what country they come from, some are more contaminated than others, or what country they manufactured in, some are more contaminated than others. So these are the things that we want to make sure that we're looking at. But these open conversations can lead to better health outcomes because when someone shares, so like for example, this young lady, she's sharing like this is what happened. It's like, okay, I'm here and I can give her like some steps to take. Again, she was giving me a story that had happened previously, and so they had already taken steps to address it, even though they took 2 months to address it, but they took steps to address it. But even that, like having these conversations or having spaces to have these conversations, it could help women and girls kind of be very open about what's happening with them. And how many times have you been in a situation and someone has shared and you're like, oh, that happened to me too, and then you can kind of figure out a way to work through it. So like these are open conversations can lead to better health outcomes and reduce some stigmas around our periods, right? um I would say, like, when I was saying before, like, not everything is always talked about when it comes to our periods and menstrual health. And right now, the popular piece of menstrual health is like talking about period poverty. And I do want to be very clear, like, part of what the menstrual workshop we will get in on period poverty, but period poverty is the lack of access to menstrual products, and that affects a lot of people. And this is why programs and initiatives and ministries like Red Wrap is so important, because when you're dealing with women who are experiencing housing, women and girls who are experiencing housing insecurity, or some sort of disparity, they're kind of caught, especially when we're talking about poverty. There's like a few different things. It's like, why should we pay a tax on something that's natural? But then what about the person who's caught between whether I should eat or pay for period products? Or the person who doesn't have any housing and is using products, and is using just kind of almost anything, things that can, leave infection or cause infection, to kind of help with bleeding so that they don't bleed through the only clothes that they have. So this is where period poverty, and talking about it is really important, but also talking about it from the space where everybody is benefiting, because yeah, we can talk about taxes and or the pink tax, as it's called. We can talk about getting those things removed, and they should, but does that necessarily or immediately help the person who doesn't have the home, or is choosing between the product and something else that's just as crucial for their basics, food, clothing, shelter. you know um the other things are like menstrual suppression. Some women, they're using, there's this idea that using medication to suppress menstruation, this is a very controversial. And some people, hormonal birth control can be one of those things that help to, yes, regulate periods, which is what some conventional or allopathic um, clinicians, that's the route that's taken. But also some people use it to suppress their periods. So some people see it as a way to improve quality of life, but that could have long-term health effects. We've already seen that, there's a problem when your period is delayed. We see that if you have delayed onset, or, there's a delay in periods, it can be the foundation, or it can lead to other adverse health effects. So you might hear some women, like, well, I'd rather not have a period, but it's a natural part of our bodies, so it has to happen. So by you delaying it, or saving it off, or whatever word you want to use, it's not necessarily the best thing. Again, it is a personal decision for some people, but the reality is, more studies show that can cause problems. So it can be as controversial as it wants to be, but the facts are there. But truth is, it cannot be denied. It can cause problems, other adverse health effects down the road. That's it, bottom line. um the other thing, so what are the lifestyle changes? Because we talked about like products that we use, and like things that we kind of normally do day to day. So then what happens is, the effects of those things, which we're probably not connecting and putting together, that just become normalized, like dealing with a painful period, dealing with a heavy period, because we kind of do these things day to day. So what are some lifestyle changes? And you may not even realize, like, it's a lifestyle change that's needed in order to address some period problems or menstruation problems that you're having. So what are some things to maybe kind of key in on, that you can kind of change to better your menstrual health? Peace, Sovereign Eats. So lifestyle changes, and this is interesting because I also do a diabetes course with some individuals. They are great individuals here in Raleigh, and we talk about lifestyle changes all the time, because when it comes to preventing type 2 diabetes, you want to make a lifestyle change. So that lifestyle change can affect many different areas of your life, and it can greatly impact your menstrual health. So eating balanced diets rich in, obviously, fruits and vegetables, and omega-3 acids, or omega acids. And here's the thing, it doesn't always have to be fish oil, or eating fish. If you are plant-based, you may think like, oh, or maybe just starting out. Um, you don't necessarily have to have fish-based or shellfish-based omegas. You can get that from black seed oil. So, fruits, vegetables, omegas, they can help to regulate your menstrual cycle, regular physical activity. And so, this is the thing that can definitely help to reduce menstrual pain. This is very true. Um, Losing weight, because when that physical activity is not only, creating movement in the body, but you're eventually going, and if you're also eating right, you're eventually going to lose weight. And I can say from like my own experience, like after losing about 30 pounds years ago, period became regular, like clockwork. You could set your watch by it. Like that's how regular it became. So like that's another thing. So like thinking about like our BMI and like how much weight we're carrying. So being physically active can like reduce that pain. Losing a lot of weight can also reduce the pain, because then the mechanisms start to move and act the way that they're supposed to do. Managing our stress, so meditation and yoga, like those can be things that regulate the cycle. And you may be thinking like, I don't have time for any of that. You can make time for the things that you want. And I'll say it like that. So if you're someone who is sitting at the office all the time, they have something called sit aside or chair aside, and you can do different workouts in your chair. A lot of different office buildings, some places are really thinking about active design. And if they're older, they don't have active design, you can think about like, just, let me go up and down the stairs. Some of the individuals that I work with for the diabetes course, they're like, well, if we can't go, if it's raining outside, I'll just go up and down the stairs. Like there are things that you can do, that you can take like 15 minutes and change, different behaviors to start to regulate menstrual cycle, and not just menstrual cycles, like other things that might be wrong. Definitely adequate sleep and hydration. That's always going to be something that's essential for maintaining like our hormonal balance. So there are studies that show that women who engage in regular physical activity, they report fewer symptoms of PMS and dysmenorrhea. So that's less physical and emotional kind of issues that may be problematic for you, depending on how severe you might experience post premenstrual syndrome, but also less pain, right? um, Low in processed foods, a diet low in processed foods and high plant-based nutrients, they can also reduce inflammation. This is a big one, because inflammation a lot of the times is the basis for a lot of issues that we suffer from, whether it's menstrual hygiene or something else. What we know is like inflammation, there is an association with inflammation and premenstrual syndromes, or premenstrual symptoms, because what's happening where it actually also affects like the cramping. So when we are inflamed, it can trigger more cramping in our uterus. I'm sorry, I'm trying to look at this chat. On a radio asks, also having enough good fats to support your hormones. Absolutely. Yes, the managing stress is a big one. Sovereignty says Kegels work for the pelvic floor and help to reduce pain from muscle contractions. Thank you for that. But yeah, that inflammation can definitely, it triggers a lot of things. So it'll trigger like what actually is related to the cramps are like prostaglandins. And so if we have too much inflammation, those are activated, and then that's where we experience like the severe cramps or cramping. So we want to make sure that whatever we're doing, and this goes back to the products we use and what we eat, whether we're doing something that's topical and it's touching our skin, even the products, like if we're using cleaning products and we're inhaling them, all of these things can be things that trigger inflammation in the system. So we want to make sure that we have reduced inflammation, so that we can improve our menstrual health. So Sabrina says, yes, primrose oil is an excellent choice to support hormonal balance and is a good fat. Give thanks, give thanks. So we did cover a lot today. From the basics of the menstrual health cycle, I'll just do a quick quiz, because we did have 2 people join us. If you can we did a quick quiz on how many phases of the menstrual cycle is. So I'll wait for them in the chat. How many phases are there in the menstrual cycle, and what are they? So, and also, beloved Anu and House of You, y'all feel free to join it again and see if you retained it. So yeah, so while they're doing that in the chat, we did cover a lot today, from the basics of the menstrual cycle to the importance of having those open conversations and recognizing menstrual disorder. And then those lifestyle changes, they can definitely have a positive impact on our menstrual health. And I would say, depending, it's a personal choice. Do not hesitate to seek professional help, whether it is someone who is more allopathic or conventional medicine, or someone who is more holistic and a naturopath. You do have some people. Thank you for very good. You do have people who do both, and so you can find someone who can help you through that process if you just don't know what to do. I do want to share. So for those of you who are watching and those of you who watch later, we do have an initiative with Red Wrap where we are collecting period stories. So you can share your My First Period story, and I will put that in the chat now. And I'll also try to put it on the screen. InLifeGlobal.org, Red Wrap. So here's the link in the chat, for those of you who are watching, or even if you're catching it, because you will be able to see this. You will definitely be able to see the chat later. Menstruation. I'm gonna go into the chat and read the answers. Yeah, so you definitely will be able to see this if you watch the video. And for those of you who are listening, definitely go to www.anulifeglobal.org/redwrap, and you can, put in your first period stories. So we're collecting those because, again, this goes into the idea that, like, having the open conversations can definitely help another sister, whether it's another woman or someone who's young and just starting a period, and they can hear some of these stories. So definitely go in and, tell your friends, tell your mama, tell your grandma, we'll take them from everybody, because if they're a woman, they have had a period at some point. So we want to hear some of those stories, whether they're funny or sad, or, and you can deliver the story as anonymously as you want to. You don't necessarily have to leave your name. And if you don't, I won't even see it. Nobody will see it. So you can choose to leave it anonymously, and we can't see who left it. So, definitely share the story, like, regardless if you feel comfortable enough, regardless if it's funny or sad or traumatic, because some of those things, and, share what happened afterwards, because this information definitely helps those coming behind you, or, those who might be experiencing it at the same time. So I'm going to go to the chat and see what some of the answers are. So beloved Anu, she said 4, menstruation, follicular ovulation, and luteal eyeballs. Correct. House of US says, Sovereignty says 4, follicular activative, lutein, lutea. Not quite, but you're kind of on the right track. House of US says, I found that eliminating meat reduced heavy flow, and using natural menstrual products remove cramps. You know what? Thank you for saying that. And I'll share my own story. Like, I had a similar experience. So, like, I had, like, kind of two. So one was like extreme weight loss. So I lost a lot of weight, and this was like, late 20s. And that's when my period just like regulated. But then it started to get like funky again once I gained weight. So I realized, like, I have to stay under a certain weight in order for my period to be regular. So you'll see these things. And so then it's like, okay, what am I eating? Like, how much sugar am I taking in? Sugar is everywhere. Sugar is like crack. Like, you have to be mindful of, especially refined sugar. So then there was, the second time, there was also a weight loss as well as an entire lifestyle change with diet. And so I had a very similar experience as you, House of You, where eliminating meat, it definitely changed the flow. There were like no cramps, no nothing. So it makes you think, like, what was in some of those things? Like, a lot of the food that's here is injected with things. And even if it's like from the healthy aisle, the healthy food aisle, or, I noticed that just for me, like, not taking in animal animal meat was better for my menstrual health, definitely. Savanese says menstruation is the first phase, actually part. Yes. Okay, cool. I meant to write Okay, I guess you meant ovulation. So yes, so I'll go back over it. So yes, beloved Anu got it right. So 4 phases: menstruation, follicular, ovulation, and luteal. So even, if there's you don't know, like, even start there. So like, even I want you to kind of go back and think, like, how many of you who are listening didn't even know what the phases were? So you want to make sure you know what's happening with your body. And it's maybe as simple as start with knowing what the phases are and what's happening in each phase. Um, so that is our show for today. Definitely make sure you check out, and I'll put it back on the screen. Definitely make sure you check out Red Wrap on anulifeglobal.org and fill out the form for sharing your period story. Subscribe to the podcast as well as follow us on social media. You can share your period stories, even if you want to share it in the comments, and we can take it and move it over to the period stories. Definitely engage and ask questions. I love when people ask questions, and we love when people have things to say in the chat. You can engage live, and if you have questions even afterwards, definitely feel free to put it in the comments of the chat, because I'll always respond. If there's anything that you want to share or something you want to hear more about, feel free to suggest it, because we'll see if we can talk about it, and we'll do the research and get the information out there to you if there's questions that you have. So again, subscribe to the podcast, go to anulifeglobal.org/RevRap and share your first period story, and definitely ask questions. I'll follow. We have a few questions. Sabrina says, both extremes affects it. When you reduce body weight to an extremely low weight, your cycle reduces. Yes. And she says, when I went raw, my cycle disappeared for a while and regulated that. Right. Because that's an extreme. You go from eating cooked food, and you're taking in food in a certain way, and then, like, all of a sudden it's like a shock to the system. So yeah, I would imagine you went through a reset. So yeah, definitely, this is why, like, it's important to understand, like, what's good for your body and what's happening with your body. It's good to know, like, what should and shouldn't happen. Like, are you kind of in the norm? Is your cycle, within that 3 to 7 days? Your menstruation period, your menstruation phase within that 3 to 7 days. Is your entire cycle within that 21 to 35-day period? Is it pretty consistent, or is it jumping around? Do you notice whether the seasonal changes, affect how your period moves? Like, those are the things we should be paying attention to. And if you are unsure that you can do it on your own, definitely enlist the help of a clinical professional. So with that, thank you so much for joining us. This has been our show on periods, and there's definitely more that we can talk about. I'll definitely put information about the sharing period stories in the comments, in the description box. For those of you who are interested in the workshop with Columbia University, for students, I'll definitely put that information in the box and encourage you to sign up. And you can sign up for the menstrual health and hygiene workshop, where we'll dive into the correlation between, like, beauty and different products and menstrual health. And definitely sign up. And if there's other information on public health and health information you're interested in, you can also sign up for Columbia University's Epi Summer program. So I'll also be teaching a workshop at the end of this month on health promotion. So if you're curious about how that's done, definitely sign up on their site, and you can get more information from me there. Peace, everyone, and we will see you in 2 weeks, where we'll be talking about a lot more. So we have a lot more things. We'll have one more episode before we go on summer break. And when we come back from summer break, we're going to come out the gate swinging. So we've got one more episode before summer break. So make sure you stay tuned. That'll be episode 54, and we're going to make it great. Peace, everyone.